It's now my pleasure to introduce Linda Lim. Linda's a registered dietitian specializing in pre-dialysis nutrition, working in the kidney care clinic at St. Paul's Hospital. Linda's been involved in kidney-friendly grocery tours, recipe and educational resource development, and has participated in a DVD reviewing dietary components of pre-dialysis nutrition. Linda's going to discuss nutrition for patients with kidney cancer from a kidney health perspective. So, Linda, thank you.
High up here. Okay. So good morning, everyone, and thank you for inviting me to come speak with you today. Since I only have about 20 minutes, I think I'd better just go right into my presentation. I'm going to start off with an introduction, then go right into talk about eating for kidney health, a couple of other health concerns. I have one slide that says don't jump the gun, and then I'll give you a little bit of take-home help. So by way of introduction, I do work in the kidney care clinic at St. Paul's Hospital, and as part of a team to help to try people preserve the kidney function of the kidney that they have left. And I see that a lot of you earlier have had nephrectomies and may have only one kidney left. So our group, what we do is we have a nurse, a dietitian, a pharmacist, and a nephrologist, and we see people on a regular basis to try to help preserve kidney function for as long as we can before you might eventually need dialysis, or you might not. I just want to clarify too that the information I'm going to give you today is really based on someone who is actually eating well, has good appetite, that you haven't had any major weight loss, and that you're right now not suffering from any effects of your medication impacting your appetite. So the eating for kidney health is what you all want to hear about. I'm going to talk about choosing variety and moderation in your diet, talking for sure about reducing salt or sodium intake, talking about eating just a moderate amount of meat or meat alternates in your diet, those are the protein foods, and talk about drinking adequate fluid. So in terms of choosing variety and moderation, it is important that you do eat a good balance of foods in your diet. There's no need to start to become a vegetarian if you're not already a vegetarian, but just moderation, small amounts of everything usually fits. So you remember the old Canada's food guide? Well, this is still very, very relevant to all of us. We need to eat a variety of foods from each of these food groups. Every day, the fruits, the vegetables, the grains, the dairy products, and the proteins. So the important thing is that you want to try to eat at least 3 out of the 4 food groups at every meal. Now, for those of you who may not have a great appetite and say, or I just don't eat meals, and you prefer to graze, well, the important thing to remember is that you're going to be grazing from a different food group each time you graze, so that you're not always going back to the grain group or always going back to the dairy group, but just having good variety. So reducing salt and sodium intake, and I'm going to use the 2 words interchangeably. And it just so happens this week I myself had attended 3 different conferences, and the professionals involved kept on emphasizing how important it is for kidney patients to watch out for their sodium intake. So what's so bad about salt? Salt can increase your blood pressure and damage the kidneys some more. Salt can also hold in fluids and make your ankles and your fingers swell up, and can make your breathing difficult. So that's the main reason. So where's all the sodium coming from in our diet? 77% of the sodium or salt comes from restaurant meals, processed foods. So if you go to the mall and have a meal, you're having takeout food, maybe you're buying a frozen dinner from the supermarket, buying that barbecue chicken from the store, that contains a lot of hidden salt that you may not be aware of. Other sources of the salt in our diet could be naturally occurring from such things as drinking milk. There's sodium in milk, in bread. Sometimes while you're eating, you might be adding salt to your food. You may be dipping that piece of sushi into soy sauce. Or when you're preparing your soup at home, just adding the salt. And when you have a big pot of water, it's easy to lose track of how much salt you're putting in. So how much sodium do I really need to eat every day? So the first column, the daily recommended intake, is for about 1,300 milligrams per day, according to Health Canada. And the upper limit is about 2,300 milligrams per day. That's the upper limit to avoid any health risks. So I'd like to keep the daily intake for my patients between 1,300 and 2,300 milligrams per day. Typically, the intake of most Canadians is way up there at 3,400, and unfortunately, Asians, the Asian diet, eats way more than that, more closer to 5,000-6,000 milligrams per day, and that's why a lot of Asian people have high blood pressure. You know, it's very high. So, very many of you read labels out there. I know people tell me they do, that they go to the supermarket and they look at the box and read the label. But do you really know what you're looking at and what you're comparing it to as being too high or too low? So first of all, what you should do is just have a look at the portion size on the label. This product happens to be cereal, and looking at the portion size, it says 1 cup. So based on that 1 cup, the next thing you should look at, and for our purposes, we're only looking at sodium and not the other things on there. So just looking at the sodium word, then you would look at the milligrams of sodium. Right beside it, it says 250 milligrams. And as you recall in the previous slide, I said 1,300 for the day. So if you have a cup of cereal, that's going to take up 250 milligrams already. There's something called the percent daily value that's on here also. If you see it right up here. That's a percent daily value. And if you were to look on the website for Health Canada, they explain what it is, and it really is the most confusing thing to figure out. What the heck is a percent daily value? So I think over the years they've tried to make it easier for everyone, including dietitians, to understand what that percent daily value is. So if you look on their website now, basically what they tell you is look at it this way. If something is between 5 and 15%, then it's probably a low amount for that product. So 5 to 15%. So with this label, this product, the percent daily value is 11%. So that is one that you could probably choose when you're in the store. That daily value is just to help you shop when you're in the store to decide. If you have 3 products, 3 different cereals, and you look at the serving size, you'll look for the one with the least percent daily value to choose. Watch out for salt in disguise. Kosher salt, sea salt, you've seen those Food Network shows, those chefs on TV, they swear by kosher salt or sea salt. Is it better quality? Does it taste better? That's what they say. But salt is salt, regardless of what kind you choose. Things that are pickled, if you buy any cucumbers, lots of salt in that. Brining. Brining has become really popular over the years. You hear about people brining turkey at Christmas time. That's just putting your meat in a salt solution and leaving it there so that your product can soak up the salt and make it more tender when you cook it. Smoking of fish, smoked salmon, lox. And seasoned salt. Things that are called seasoned, like if you buy garlic salt, onion salt, it's not bad to use the onion and garlic. It's just that when it's combined with the salt is just more than what you need. And again, chicken, you probably see it in the flyers, you know, chicken breast for sale. I know the stores always have it. And it's called seasoned chicken breast. They have injected that with salt. So that again, when they freeze it and you buy it, take it home, it's really nice and plump when you thaw it. So these are just some things that are high in sodium that you've probably seen and you probably know in the supermarkets. But things like soy sauce is a big one. Any of your sauces, the Oriental sauces, oyster sauce, chili sauce, teriyaki sauce that's used for marinades. Any of your frozen dinners are very high sodium, as are the soups, as I'm sure most of you are aware of. So what are the lower sodium choices? Well, it's always best if you could prepare your own. And so if you're having rice, if you're having pasta, preparing it yourself at home is always the easiest to control your sodium. Chicken broth, chicken broth, again, there's many different brands in the market. So if you were to choose a chicken broth, again, look at the label and just select the one that has the lowest % daily value for the sodium. Chips, potato chips and those things, very high salt, but there are brands out there, such as tortilla chips, that are much lower sodium. Alternatives to salt, use your creativity, your spices, your herbs, your balsamic vinegar for marinating, red wine for marinating is always good, your lemons, limes, cilantro. Just be creative with that. Use your spices like curry powder. Use curry powder, cumin to make your curries rather than buying a curry paste that is loaded with salt and mustards. So the tips for lowering the salt. Use fresh, unprocessed food whenever possible. Plan ahead for restaurant meals, and I did not touch too much on restaurant meals, but you know yourself how salty some of the foods can be there. And use the % daily value to be a quick guide when you're out shopping, just so that you don't have to remember everything I said or that you don't have to have lists and lists. Just look at that % and that'll be a very quick and easy guide for you. Okay, so now I'm just going to continue on talking about protein. Protein in moderation. So what does moderation mean? 4 to 6 ounces a day is basically what most of us need in a whole day. It goes by your size, and for someone like myself, who's only about 5 feet tall and about 100 pounds, 4 ounces a day is about all I would need. Most of you in here maybe need about 6 ounces a day. If you're a taller person, heavier person, maybe 7, 8 ounces a day. Just want to get you away from eating that great big 12-ounce steak or go to the buffet and eat a lot of the protein foods. So eating too little protein isn't great either because it can cause muscle breakdown. You do need protein to help fight infection, to heal the wound that you might have. So you do need to eat some protein. But too much protein can be more than your kidney can handle. And don't forget, we're trying to preserve that kidney that you have left, or preserve that kidney function. So you don't want to have too much, too much more than your kidney can handle. These are just some pictures of protein foods, a good variety of them, and they all fit in small amounts. And people often ask me, what is an ounce of protein, if I'm trying to figure that out, okay? So here, an ounce of protein is about 1/4 of a cup, and you know how big 1/4 of a cup is, your measuring cup. About 1/4 of a cup of fish or shellfish or chicken, if you chop it up, is an ounce. An egg or 2 egg whites is an ounce. 2 tablespoons of peanut butter. 1/2 cup of lentil after it's been cooked, and 1/2 cup of tofu. Now, if you were to eat a piece of meat like roast beef, the size of a deck of cards is 3 ounces. So 1 ounce of that is about 1/3 of that deck of cards. And quite often people say, when I ask them, do you know how much protein you need? They say, oh, I'm supposed to have the palm of my hand. And not everyone has the same palm of hand size. So that's why I like to use the deck of cards. And don't forget, these are proteins too. They're your dairy products. So a cup of milk is a protein, cheese, an ounce is protein, and yogurt is protein. So watch out for these because they're high salt, high fat. The cheese whiz, the bacons, the lox, the hams, sausages. These things are just best left for special occasions. You go, once a month for brunch, have it then, rather than keeping a whole package in your fridge and then you have to eat them all. Fluids, the next thing that helps your kidney is drinking fluid, 6 to 8 cups a day, unless your doctor tells you you have some kind of heart failure or some other reason for restricting your water intake. So water is the best fluid to drink, just plain water out of the tap, fine. Milk and juice, I'll count it as part of your intake a day, maybe a couple cups of milk, glass of juice. Occasional use of soft drink, and I know you won't use that too often, sugar-free soft drink. Coffee or tea, I tend to put on a maximum of 3 cups a day. Again, Health Canada recommendations. So these were the 4 points about eating for healthy kidney: the variety, the sodium, the protein, and water. Like I said, in my practice, I go over these in a lot of detail and recipes and alternatives all the time. A couple of other things to be aware of. There are other health concerns that could impact your kidney function. So if you have diabetes, make sure that you are protecting your kidney by managing your diabetes. Balanced diet, exercising, stay active to help your blood sugars. And if you're taking medication, take the medication, check your blood sugars, and keep a good record for your healthcare team. The other health concern, cardiovascular, for healthy heart, make sure you are eating your lower fats, your skin off the chicken, low-fat dairy choices to keep your cholesterol and your lipids in check. One slide on potassium and phosphorus, and here's where I say don't jump the gun. Some of you might have looked on the website and decided that, oh, I'd better be proactive in this. Potassium and phosphorus are minerals found in foods, just like you would find vitamin C or calcium in foods. You also find potassium, phosphorus in foods. And these two minerals, it gets a little bit more difficult for your kidney to excrete as kidney disease progresses, and therefore we might need to restrict them in your diet. But please, please do not restrict these until your doctor tells you, and your doctor will know by doing blood work. Because if you start to restrict too soon, it really narrows your diet down and cuts out a lot of things in your diet. So then your diet becomes restrictive, and best to do it, under the care of your doctor, and he could send you to a healthcare professional to help you along with that. So these are the components of the kidney diet that I often show to my patients, just so that they will have a visual when I first see them. We always talk about the protein and the salt, and this is great for everyone in the family. And then later on, we talk about potassium and phosphorus. So if you need more information, the National Kidney Foundation website is a great site, and I think their logo is Living Well with Kidney Disease. So it's there. Look for information for pre-dialysis patients. Don't get carried away with diet for dialysis patients, because it is quite different, and it would be the wrong way for you to go. The other resource that's very good is HealthLink BC, and this gives you access to a dietitian by phone. So all you have to do is call their toll-free number at 811 and ask for a dietitian, and they'll answer questions for you, with regards to kidney disease. And I know they would know because one of them just came and worked with me for a day not too long ago. And they also have multicultural translation. So if English is not your first language, they can simultaneously interpret for you. So those are your best resources, and other than that, there's always referral to an outpatient dietitian if you think you need help combining things. Okay, so that about concludes my talk for today. Thanks very much.